Wow, another two amazing episodes from In Treatment this week. I'm Charmaine Jackman with InnoPsych, and I am here with my friends and colleagues to dissect the shows from a therapist perspective. We're going to say what's for real, for real. I love
Yes.
talking about mental health, and I just love the opportunity to debrief these episodes and to kind of unpack what's real, what really happens in a therapy session, what might be contrived for a show, but just to kind of also talk about the issues that are coming up in the different episodes. I'm going to turn it over to Dr. Vanessa. You want to introduce yourself?
Yes, hi. I'm good evening, everyone. I'm Dr. Vanessa Prosper. I'm a child and adolescent psychologist. I work in a high school. I also am a professor, and I have a small private practice.
Welcome.
And Dr. Shani.
Good evening, everyone. I'm Dr. Shani Turner. I am a clinical psychologist. My work has focused on children and adolescents. I'm currently an assistant professor at William James College.
Excellent. So we'll start with Layla. We'll go in order, but we just want to note that last episode was really heavy, right? I needed to breathe through that one.
Yeah.
But Layla starts out, she's funny. She is such a teenager.
Yes.
She reminds me of so many of my adolescent clients, but it starts out with her doing a mental health message to her social media audience, which I thought was very cool.
Yeah.
But we see her entering the session, and we talked about maybe doing a format. So what we're going to hear us talk about today, we'll talk about aspects of the show that we like, things that we had concerns of, maybe things that were problematic, and then things we're looking forward to seeing how it might unpack, how it might unfold throughout the show, or any other things that you want to talk about. So let's start with you, Dr. Vanessa. Tell me something. What did you like? So, Layla's story. What did you like about the session tonight?
Well, I think I'm trying to remember. I think I liked the fact, like, she seemed after the first session definitely that Brooke, the psychologist, was able to establish a good connection with her, so she was able to come back and open up more, but still kind of defended or guarded about different things. And I think that the therapist did a good job kind of like challenging her every time she was trying to hide behind either like her stories or fantasy, especially in the beginning of the session where she was just kind of talking about everything and everything.
And we see that with clients, right? They're a little bit nervous and they're not really sure what to bring in the session, or they don't want to deal with something. We kind of see that happen.
Yes, and I liked how she was continuing to build rapport, but also calling her on her stuff. So that's what I liked about that session. I don't want to go into, concerns, but yeah.
How about for you, Shani? What did you like?
I like that. I think it's very similar. I think that this session had more clinical structure to it. And I like that from the first time. And I think that Brooke did a better job at kind of naming the behaviors that were going on in the session and trying to redirect Layla in a way that got her back focused to kind of why they would be in treatment, why she's in treatment, what is she looking for. I think even at the beginning, Layla is very smart and she lets that be known consistently. And I like how Brooke is not overwhelmed by that. She doesn't challenge that. She allows Layla the space to kind of be herself. And I love that part of the session, that Brooke recognizes how smart and intelligent and educated this young girl is and allows her to be. There's never been a chance that she's kind of spit off historical facts or talked about, what other generations have done to the country, to the planet, that Brooke has shut that down. So it's to me, creating a good, I love that. And it's creating a good space for building trust, because if she lets her be expressive, maybe in a way that other people don't let her be expressive at home. or in her spaces outside of the session. So that's another thing that I think I watch and I'm like, oh, that's good. Don't challenge it. Just let her go.
Let her go. She was using her Latin, breaking down words.
Yes.
Yeah. For me, I loved how they talked about racial trauma, right? That Brooke kind of talked about her experiences in school. And it was so funny because, Layla talked about her experiences in school. And Brooke was like, are these things that actually happened to you? And she's like, no, but like the worry that they may happen. And I'm like, that is such a great description of the emotional labor that we walk around with as people of color when we're in white spaces. And just, just worried about the person who's going to say just the wrong thing and what you might do in that situation. So you can see her carrying that out and Brooke naming that for her in that session. I thought that was really done lovely. And I just love how they just are continuing to bring race and race conversations into the episodes.
Yes. I love that. Yeah. When to just piggyback off of that, I wrote down racial trauma, and I love that the character Layla really showed those emotions in the moment. And and Brooke watched her go through kind of like talk about that tension.
Yeah.
And this is a fantasy. This is a thought, an idea, an image of in her mind about what happens if I go through this situation. And the fact that the character then showed you that emotional response, which led to some panic features of what we would see as a panic attack, right? Like you could kind of visibly see that coming. How powerful that is for HBO to kind of show the reality that Black and brown people may be experiencing at times. Just the thought of watching someone die on social media, watching someone killed by the police, that brings that racial trauma and those responses. And so I just thought that was so powerful. Again, HBO coming through.
I know.
Yeah. Now they use the N-word straight up.
Yes.
I was like, okay, HBO, what do you think is going to happen? You think they're going to get some backlash about that?
I'm looking at the context in which it was used.
Yeah.
If this was real life and we had a hidden camera, right, this would have happened. Like, and also because it's coming from a Black person too, versus a white person saying it. I'm thinking it should be okay, but what do I know? Some people. But I think it made it more real, right? In terms of like, when she said like, I wish an N would, like that's an expression. And
well, she used they used both. They used the ER and the A came up in the session.
Well, I think,
but I think it's in the context,
I think it should be okay, but we shall see.
We shall see. Now, if it was a different patient, if it was Colin, that it used the context of saying something, it would be a whole different position. But here we have this girl visibly upset about a situation happening, and she's fantasizing, right?
Yeah, she's thinking that these are what people are saying about her.
Yeah.
Okay. That was still bold, though, I think, right? Yeah. It was so we'll see. So, so I think those are good. Yeah, I think, again, just bringing in like real life current. I mean, it's so current and up to date, like the issues that they're dealing with. What concerns you?
Oh, the list.
I mean, we have a few things like the self-disclosure that we see as a theme.
So we talked about that. Yes.
Right.
So So the self-disclosure is Brooke talking with her teenage client about having a pregnancy, and being sent away and have that child removed from her care. And we talked about like, how do we use self-disclosure in therapy is you want to be really thoughtful about that, right? You want to, usually when we talk, when I work with trainees, in that beginning session, I'm like, think about the things that you want to share. Sometimes people come in with different parts of their identity and they want to share. I'm like, okay, so you have to think about, is that for you or is that for your patient, right?
Yeah.
And if you are going to share, what aspects of that story that you want to share that can help your client, right? Your patient.
Exactly.
So I know we each all had concerns about her disclosing that. So you guys want to share for you, like kind of what you thought was problematic about that?
For me, I think it just was the extent of how much she shared, and that and I think we talked about this, the extent of how much she shared, and that it wasn't necessary to get the point across. It wasn't necessary to build on that therapeutic rapport. There would have been many other ways in which she could have disclosed pieces of her past, pieces of her experience in her teenage years being difficult without going to that extent. And I think more importantly, because we understand that's still a traumatic event for her that she's processing through outside of her job. And so this is a sensitive time where she just lost her dad, and to continue to bring in the real life struggles that she's having. Like, I just think about, like, next week she's going to sell somebody she's like, a recovering alcoholic. Like these things,
which
the
is
real things that she has now.
Right.
You shouldn't be disclosing those.
Yeah, and to your point, Shani, too, in terms, like, I think, and what you were saying, Charmaine, like, the point of self-disclosure is really to help the patient, right? So in that case, we see Brooke wanted to help Layla in terms of, like, saying, like, hey, I get it, what it's like to feel controlled by adults, not having the freedom, but she didn't have to use the pregnancy example. She could have used the fact that her dad wanted her to go to business school and she ended up being like a psychologist and things like that, because that's not as traumatic for her, or that's something that she's resolved because clearly she's a psychologist. She got to do what she wanted to do, versus like the whole pregnancy thing. That's still something that she's processing.
Right. And I think that's the piece too, right? It's like, I know there's some therapists who may share more than we would, right? Some therapists might feel that was okay to share, right? Depending on who the patient is and what they're working with. Maybe if you're working with patients who've lost children, maybe that might be an appropriate thing to share.
Yes.
But I think, the thing that we talked about is something that she's still actively dealing with and processing and is not in a good place with it. And so to do that, we worry about her losing a sense of understanding. Is that disclosure for her, the client? But also a sense of the boundaries that we set from day one, right? So how is she able to contain, what she shares and that relationship? And, so I'm thinking ahead too, like, where is this going to go? Because this is going to come back to bite her. This is going to come back to bite her.
And I think that's what's important for anyone watching this to understand. I don't think that any of us are describing that we don't let our patients into parts that, or to know parts of us. I don't think that that's what we're saying. For this particular clinician, we can see play out that she has some of the things she disclosed are still issues that she's sensitive about, meaning her dad dying and the loss of her father, she's still mourning. If Eladio takes that and uses that in a way that is negative towards her, so is upset with her and says something about her dad, because she's fragile in a sensitive place, she could fall apart. Layla could say something, well, you gave up your child, or that's coming next week. Next week she's gonna say something, because she's in a sensitive space with that. She could respond not as a clinician hearing the child project their feelings or try to avoid an emotional response to them. She could hear what is said and react. Right. And that's not what we want to do as clinicians. And that's why we have boundaries. And that's why we don't disclose the personal nature of our lives into the session, so that the session is true to what this person is going through, right? And not about our lives. And now that dance is in play in the session. Like, okay, you know something about me and you're using it, where that shouldn't have room. There should be no room for that.
Yeah, so that was one thing. The other one was a biggie too. What was the other one was dear Dr. Taylor, the patient asked her not to say anything to her grandmother, and Dr. Taylor readily agrees not to say to the grandmother without checking first what the child is going to say. Yeah.
Mm-hmm.
And so again, therapy 101, when I'm working with my trainees, and actually because I'm in a school setting, I've had to also have that message with teachers. Do not promise students that you'll keep anything private because you don't know what's coming out of their mouths next.
Yeah, exactly.
Yeah. And even with her being, even with like being a college professor, working with that transitional age, it still applies. Mm-hmm. Even though they are 18, 19 years old, right? Those ages important because it's playing out here. 18, 19-year-old discloses something that they've done with a 15-year-old.
Yes.
You just told them they're an adult. This treatment is about them. Everything stays in here. But wait a minute. Now I have to go back and backtrack to have this conversation with you that actually here's the one thing I can't keep confidential. That's why we have those statements. That's why we have consent forms. That's why we talk to our patients and let them know. And this was a real concern. It was a major, major concern because she didn't address it. It was a perfect opportunity for her to just put that out there so that the adult child, Layla, understood what those boundaries are. And Layla's smart. As I said, right? Layla's smart. Layla knew. She was like, listen, I'm afraid. I don't want to disclose. I don't want to be talking to you about all these things because I know she's 15 and you're going to impact us being able to see each other.
Right.
And what does Brooke respond? She's like, oh, no. Do you really think I could ever stop you? Yes, I do.
Well, right. And the fact is, then she disclosed they're going on some trip. And for me, I'm like,
with a
what?
15-year-old?
With a 15-year-old, right? So, you might have to tell somebody. And I'm like, I don't know. I mean, I don't know. Like, I'm getting to see Layla, but I think there's a lot of things that she's troubled by. And I'm like, this could be a suicide pact that they're planning, right? Like, you don't know. You don't know what.
There's so many concerns that I would have liked for Brooke to delve deeper into, especially when Layla was talking about like the multiple car accident. What is that about?
And she has this bruise on her face that she never really came clean about.
She didn't. Yeah, she ended up saying what it was. She just said there was a car accident, but there's many car accidents. Why is that? What's happening there beyond I was not thinking. But yeah, I was like thinking, maybe it's like, suicidal attempt. And then the fact that, yes, like we said before at the end, she was like, yeah, I'm going to go away or maybe forever. What? Yeah. What? And then she doesn't do that. And then there's another opportunity to talk about the limits of confidentiality and to also talk about the inappropriateness again about the girlfriend being 15, she's being 18. Like, wow, it was just a lot.
It's a lot. Yeah. And then that session ended weird. So like the sessions this week ended really abruptly.
All
and
of them,
what happened? I mean, it was like something shifted for her. It was like, I'm not going to tell your grandmother, but your grandmother's out here. Like, it was just very bizarre the way that she ended. She stood up, which is a sign to leave, tension is over. But clearly, Layla was still processed. She's like, and also Layla in that moment felt like she didn't believe her. The way that she kind of closed out that session.
Yeah, she's not doing good at all closing sessions, and it's really concerning. Like, she doesn't have a way to wrap up the thought in the moment and then be able to transition the patient out to say, okay, let's pick up here next week. And over the week, here's what I want you to think about. There's never really there's not a CBT model that's always happening. The psychodynamic is happening much more, right?
Yes.
But there's never even, I think there was once that she had some things with Eladio. And I hate to keep going back, but I just think about her as a clinician when I'm thinking about this, because I also, when she's talking about the accidents, I think that was a perfect opportunity to do some mindfulness, right? To do like some deep breathing. I think this patient, when she started the session and was just kind of all over the place, ground her, take a second and walk her through 4 minutes, 5 minutes, and then allow to open up the space. And this might be a patient that I do that at the beginning and the end.
Right.
So that transitions us out. And she just stood up and confronted her. It was almost overpowering her, confronted her. And now you the progress for the rapport where you disclosed all this information about your life is backtracked.
Right. Yeah. So she was she trying to assess? It seemed like she tried to assess if she was like losing time or dissociating as well when she was getting into these accidents, right? She was asking a little bit about that. She was trying to figure out what was going on. But I think she didn't really I think she could have gone deeper to really find out what is happening. Is she drinking? Like, is it after substance use? She didn't ask any of those questions.
Yeah, to me, I was curious, like, what happened the first time, the second time? Is there a pattern there?
How many?
Right. Is it attention? Is it to get the parents' attention? I mean, clearly there's no, like, she's also saying these things happen and nobody's alarmed by the fact that she's getting into all these accidents.
And then her dad gets her like a even more luxurious car every time. Like, what is that about? Yeah.
And she's so young. We're talking about an 18-year-old. She said the first car was at 16. So in the last 2 years, how many accidents have you really gotten into that no one's saying this is a problem? Something else is going on with your focus on the road. Let's address that. Let's put her in, is it anxiety? Is she getting overwhelmed with traffic? What is it? And there was no follow-up questions.
Destructive, it's just like,
yeah. So to be continued. It did end. So she ended there, and then it was like the grandmother's picking her up too. So like, what was that? So then there was this mixed message, and then the grandmother's like, "Get your the grandmother was very kind of aggressive with her." So there's something. Yeah, there's a lot there in that family dynamic as well. Okay.
Yeah.
So any predictions for next week? So Shani, you already feel like something's gonna happen, like the way that this session ended is gonna come back to kind of haunt her. Layla, because Layla did feel a little bit rejected, right? I feel
absolutely, and she's not gonna sit well with that. I don't think she's gonna sit well with that. And I absolutely predict that if it doesn't come next week, it'll come the following week. That Layla uses that giving up your child. Layla already struggles with the relationship with her father. So where you thought you were going to align with her about the trouble of being a youth, what Layla heard was, you don't love your child like my dad doesn't love me, right? Or like maybe my mom doesn't love me. And I absolutely feel like that will be what they write in there for next week.
There's a parallel between her and Layla too, right? These rejecting, or not necessarily rejecting, but absent fathers, right?
Yes.
The mother
who are controlling.
I can't remember what is her mother dead or is her mother not in the picture? I can't remember. Do we know?
I think we did find out on the first episode. I think we did know that from the first episode, but I don't remember.
Yeah.
I don't remember.
So there's a parallel there too. Like the mom is not there. The dad is physically there, but not emotionally there.
Right.
And I agree with you, Shani, too. It's just kind of like, what is that? Like, Brooke saying that she had to give up that child. But also at the end of the session, I felt that Layla felt listened to up until that point, right? Like, well, you're not saying anything. And then at the end, Brooke saying kind of like, well, you don't seem to have a plan to go, wait, we'll talk about it next week. Just like very, I think that Layla
dismissive.
Yes. And so I think she's going to come, definitely.
She's going to up the ante, because that's how she feels. Like people don't really believe her, like her imagination, and they don't. So
she's going to do. It seems like Layla does things unconsciously and consciously to get seen, to get attention, and so she's definitely going to provoke her even more.
Yeah, that's what I think.
Yep. All right. So moving on to her session. with her. I don't even know if that we call that a session. It is kind of a session. Um, is it Ruth? What's her name? Rita? Rita was in the therapist chair.
Yeah, she was.
Yep. She does such a good job.
Yeah, she does. And I can she says, I'm just a guidance counselor. Well, you use those skills so well, just so well. And I think she knows her that I just love this session. I loved it.
Yeah.
Yeah, me too.
Yeah. So we see at the beginning of Layla's session where she's come home with 2 grocery bags full of alcohol. She's unloading. So, and I don't think has come up. So I assume that she's supposed to be sober, right? And usually people, when doing NAAA programs, it's like abstinence, right? You don't do it at all. So there's a lot that she's hiding from Rita. And we also see that she's ignoring Paul's emails and calls.
Yep.
What does that mean?
Yeah.
Yeah. So what did you like? So we're going to do what did you like in this session? You want to start with Shani?
Yeah, go ahead, Shani.
I liked watching her be challenged. Mm-hmm. I liked watching her have to sit with not wanting to face her emotional responses, her emotional reactions. I liked Rita just asking her questions that were very logical. And I said this at the beginning, like pulling out the pieces that she sees of her patients, watching her do that with Rita, watching the projection instead of sitting with the emotion, understanding why you're having this emotion and kind of allowing Rita to do what she was doing and walk you through it. It's like, well, don't you have this problem? Or what do you mean? Can I have fun? Can I do this? It was all to deflect in what she was really feeling. Yeah. But I love that Rita's, which I don't think that Brooke, like this is the part I think that's different from Rita and Brooke. Rita kept calm.
Yes.
Even no matter how Brooke tried to pull it back to Rita and pull her into, something about, their life. You have children. Are you happy? Or who are you dating? It hasn't worked for you. Like, no matter what she said, Rita was calm. Yeah. And Rita was able to still push a little bit for her to think about it. I'm concerned, right? Like that's the part I loved. That's the part I loved. That's the part I loved. I loved watching that dance and that play. I thought it was a really great therapy session. If it was truly a therapy session, it was really great.
I would agree with you, Shani. Like, I like Rita from the first show, just very calm. Also, how she's not afraid to challenge Brooke about her stuff, like calling her on her stuff constantly, but also kind of like, integrating some like pearls of wisdom. Like, I like every time how she was able to show and demonstrate to Brooke, like kind of like how she's dwelling on her past and so missing on her present and her future, and how she needs to deal with her past. Really like kind of like really hash through, like, how do you say that in English? Like, she really has to digest her past so that she can move forward. And constantly letting Brooke know, like, you need to move on. You need to figure this out. Which you could see that Brooke has a hard time, because every time it's almost like she feels stuck and constantly ruminating on her past, because as we were saying before, like it permeates her sessions with all of her patients, because she's still processing these traumatic events that happened in her past.
Yeah.
Right. Yeah, I agree. I loved how she was able to get her to talk about just kind of the loss, right? And the wanting to reconnect. And I love that Rita was like, who is this for? You going to see is it about you? Yes. Or is it about him? And she kept coming back there. She kept coming back there. Yes, you want to apologize, but who's that for? Is that for you? Or is that for him? Right? She just kept harping. She was good. She just kept there. She did not get swayed. She was just buoyant. And she was like, And, she was communicating, you can't go looking for him when you're not right. You're not ready, right? Like, he doesn't need to be exposed to that if you're not ready. Like, yes, because he may not forgive you. And then what's going to happen to you if he doesn't forgive you?
She's going to melt away.
She's going to be done, right? So you got to be ready. And I love she says, like, I'm not saying don't make that decision, just not in this moment, right?
Yes.
Not right now. Not right now, right? Because you're not ready, right? You're not ready. And you have to be thoughtful, and it can't be just about you. You have to think about what's the impact on him. And that was just beautiful, how she did that.
Yeah, I agree.
What was problematic? What did you have concerns with? So it's funny, the thing that I noticed is that we're not seeing, because Rita is not her supervisor, is that you're not seeing her talk about her cases, right?
Yes.
But you would probably, if it were Paul or some other clinician, she might be able to talk about things that are happening in her sessions with clients with that person. So we're missing her being able to have the insights, and for that person, excuse me, to make connections, like you're projecting or you're too close, like your clients are having similar issues. So it'd be interesting to see if they will bring Paul in so she can have some of those conversations, because right now it's just kind of her own lens, which you know is clouded, right? Her judgment is really clouded.
Yeah, I hope they bring Paul in, but I don't know. Yeah, that would be definitely interesting. You asked about concerns. I think my concern is just like what we've seen in the beginning of the session with Layla, the fact that, she's
using
bottle of alcohol she's going to use, or when she talked about, what's his name, Adam?
Yes.
Right. That it seems, and also Rita just calling Adam for what he is, like he's an enabler, and
she does not like that.
Yeah, she does not, because she's just like, why can't I just have fun? And just, I think she's minimizing the problem at hand. And of course she hasn't shared to Rita, or she hasn't disclosed to Rita that she bought all this alcohol, right? So that's my concern about her, that slowly but surely, like, she's unraveling. And then she's, through her work with her patients, which are triggering her in different ways, she's still, or maybe she's just like pretending that she is not aware of it, but I think like it's triggering her and it's unraveling her. And rather than say, okay, let me talk to Paul, let me get the help that I need, or I need to take a break, she still goes ahead.
Yeah.
Do you think she believes like she has it under control, right? She probably is lacking that insight, like I have it under control.
Yeah. And I also think that she shows that she believes these things are not impacting her.
Right.
I don't, like, even in this episode, it was really concerning, and I didn't think about it until this moment, that she hadn't been processing that she does want to find her son.
Yes.
Like, it took Rita sitting down with you to know, like, you've already been projecting with the Eladio. You didn't, but that's lack of supervision, lack of really letting Rita do what she's supposed to do, trying to fill the voids with Adam and alcohol and all of the other things, rather than really focusing in on, why do I want to fill voids? What am I void of? What can I do to do that? And then to hear, some more problematic things about just like how she sees herself, what this age that she is, that maybe like nobody's gonna want her. She can't, this is it with her life, and she has to settle for this relationship that's not healthy for her. That is all about having fun. It is not. And then she even said at one point, "You want to have a baby? Like, are you saying that?" Like, no, not really, but maybe I do.
Maybe. Yeah. She can't even decide that.
All I heard was, you need to get in therapy, because you're going to need your own therapist to really hone in on the trauma you have experienced in your past, the current loss and grief that you're experiencing with your dad, and that you have started drinking. You are drinking now.
Right.
So
Right.
you have this sponsor, but you are engaged in alcohol right now. You need to get back into treatment.
Right. And, actually, what she actually lied to Rita about why her and Paul aren't connecting. Right. She said, oh, he's busy.
Yes.
And, he's like American psychologist. So she lied.
Yes.
So in some ways, she knows, right? She knows she's avoiding.
But Rita said that. And Rita was like, are you avoiding him? And she's like,
no,
what are you doing?
What did she say? She said he's been busy. He's
an American psychologist now, right?
The pandemic, yeah.
He's called her every week. Emails, calls.
So she is not. So she knows. There's a part of her that knows.
Yeah.
What is she worried is going to happen if she reaches out to Paul? Like,
she's going
to have to deal with stuff.
Paul's going to call her on her stuff, on her transference, like because she's going to have to talk about her work with the client. It's going to come through. Yeah.
Yeah.
So part of her, I agree with you, Charmaine. Part of her knows, but she's probably minimizing it. No, it's going to be okay. It's going to be okay.
Right.
And maybe she just thinks if she waits like another couple of days, she'll be able to hold it together and like fake through that conversation. But I think that anyone that has known her and has worked with her is going to see, like Rita, something's off. The way, like Rita can sense that from her. So I would imagine that this clinician that has worked with her, if he gets a chance to kind of do a video chat and hear about the patient, he's going to hear that something is off.
Mm-hmm.
And does he, I think about which we don't really know, but does Adam have a connection to anything of her past with substance use? Like, does Paul know about alcohol abuse in the past? Because would that be something that he would be like, okay, is this a concern? Do we have to have a conversation about this? Who knows, like what that role might be there. But she definitely is avoiding it for a reason.
Yeah. So that worries me. It's sad. Like there's an enormous amount of sadness that she's dealing with. She's dealing with a loss. And I don't know if the dad's death kind of like also like opened up that wound with her son. Like I wonder, because now he's gone, she could actually address this thing that she never really addressed.
Yeah. All of that.
Yeah. But just an amount of grief and loss that she's dealing with.
The loneliness. Yeah. Yeah.
Mm-hmm. Yeah. So very good episodes. Right? Yes. I literally was like sitting with her emotion at the end of her session because it was just very heavy.
Mm-hmm.
Yeah.
What's your prediction, I should say, about the reason why Dad kept the I don't know what that was like the birth
certificate almost. Yeah. It sounds like he was someone who was really controlling and wanted to direct her life. Like image was all a part of it, right? It was the external image was very important. And so, why he kept it, it sounds like he kept everything. He might have been a hoarder.
Okay, maybe. Okay.
Are you thinking that maybe he has been in contact with the son? Maybe he's been sending money to the son?
Yes.
Yeah.
You think?
I thought that. I thought she was going to open a folder of pictures of him, softball league, baseball league, that the father has been paying to make sure that this kid is okay. And I think even though we didn't see that tonight, I absolutely predict that the father knows where he is. Mm-hmm. And maybe he hasn't met him, but there has been, anonymous donations for him. So that's going to be another huge thing that she's going to have to process, where she has so much anger and resentment towards her dad, but that she didn't get a chance to resolve that because look at what he had done, even though he made her make this decision.
Right. Yeah. I'm smiling because we're going to have to watch back these episodes to see our predictions. But that did come through my mind, like, oh, I wonder if he kept in contact with the child.
Yeah.
Is that what? So Vanessa, you were thinking that what's your thought?
And also like being like just TV shows. I'm like, there's always a reason why. I'm like, how is this gonna come back, right?
Yeah. Well, yeah, great episodes again, and we'll be back next week. We have Dr. Kwame Dance is supposed to join us, so we'll have some extra energy.
Yeah.
But that's all for tonight. Anything else you guys want to close out on?
No.
You feel resolved?
Yes, 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 yes.
And I think the message is the importance of having supervision, therapy for particularly when you're going through difficult things. I think it's really important as therapists that we're taking care of ourselves.
Absolutely.
I think that's been something that, we've all gone through this pandemic as well. We've experienced it as much as our clients have. And so what are we doing for our own self-care? I think that's the message I want to leave us on.
Oh, good job.
All right. All right. So we'll see you guys next Sunday.
Yes.
Have a good evening.
Bye.
Bye.